Hello, my name is Cathal. Some of you may know me, and for those of you who do know me, you may not know that I have Lyme disease and have had for over 30 years. Lyme disease is a bacterial infection that is transmitted by a deer tick. If it's caught early enough, it's easily treatable, but if not, the opposite is the case. I had Lyme disease for 15 years before I realised I had it. I'd been to many doctors and specialists, and none of them could put a name on my symptoms other than the umbrella term chronic fatigue. Finally, in 2005, I went to a clinic in Germany and they gave me my first diagnosis. With that diagnosis, there was some hope that I might finally find a way out of this debilitating disease. But unfortunately, that wasn't to be the case. More doctors, more specialists, and extensive periods of treatment followed, and none of them were successful. I have now been diagnosed longer than I was undiagnosed, and nothing has changed. In fact, probably worse. Lyme disease affects people differently. It can get into your joints, into your heart, but for me it is in my nervous system. This can manifest itself in terms of pain and fatigue. On a scale of 1 to 10, it can vary between 3 and 9. This can be either pain or fatigue, or both at the same time, but it never goes away. In the early days of my Lyme disease, it was actually just on one side of my body. This meant that I could manage it to an extent. I was able to hold down a job, have semblance of a social life, but wasn't really able to fully embrace it. I often push myself when I shouldn't have and regretted it afterwards. I still do that. Eventually, however, it progressed and became more intense and spread to my whole body. I'm now no longer working and my quality of life has deteriorated further. Which brings me to my GoFundMe request. There is a treatment that might make a difference for me. It's expensive, of course. The treatment takes place in a hospital in Germany called St. George's Hospital. The treatment involves raising your body temperature before administering the antibiotics. The theory behind it is that the antibiotics are more effective at higher temperatures. I recently spoke to somebody, an Irish woman, who underwent this treatment and it worked for her. Now, it might be life-changing or it might not be, but there's still hope. There are things I'd still like to do. There are simple things I'd like to do, like standing and talking to somebody without constantly wanting to sit down. It goes without saying, of course, that any amount donated would be, extremely welcome. You would have my undying gratitude, really. It would be nice maybe to get my life back.